Okay, hello. My name is Dr Malik. I'm an endocrinologist in Island Hospital. Usually, what you do is the first start is a checkup. So a checkup meaning that you would go to the hospital or go to a lab, make sure that your blood tests are in order. A fasting blood sugar level is important. Once you get the blood test, it will then tell you whether you are in a normal category, pre-diabetic category, or a diabetes category. In a way it's true, because this is the hallmark of treatment of either pre-diabetes or diabetes. So yes, you need to exercise, you need to diet and so on, but having said that, it doesn't mean that you will not get diabetes. So patients who are healthy in the lifestyle will less likely to get diabetes, but not necessarily will not get diabetes. Basically, it's all about keeping your need for good food in check. So basically, when you try to eat more healthily, eat at home, try to use less sugar in your cooking, that kind of thing, less oil, and whenever possible, try and limit the days that you eat out, because whenever you eat out, you tend to either you binge, or the choice of food sometimes may not be healthy. It's always better to have a home cooked meal whenever possible. And in some instances you may even consider taking your lunch from home, or the meals that you eat at work tap out from home, because that sometimes helps give you healthier choices. So what would I like to say? Well, diabetes can be a difficult disease to treat. And we tend to see the worst patients, meaning that we already see very, very late complications of disease. So a lot of my colleagues in general practice would see earlier patients who are newly diagnosed and so on with no complications. So diabetes is about prevention. So if you can actually prevent someone from becoming diabetic, I think that's 3/4 of the battle won. Once you've become diabetic, then it becomes more difficult and challenging. Because you need medicine, sometimes you need to inject insulins, frequent follow-up visits, blood tests and so on. So it becomes very demoralizing for some people. So what I would say to you is prevent diabetes if possible. For those of us who are struggling, for those of you who are struggling in terms of trying to manage your diabetes as well as weight and so on, there are medications, and this is perhaps the chance for you to see a specialist. There are many choices. Sometimes we even recommend bariatric surgery, which can actually lead to a significant weight loss and sometimes even cure diabetes. So there are many options out there. You just have to seek the appropriate specialist advice. What is your advice? Well, try and do as much exercise as possible. It may be walking, it may be weight training, it may be simple cardio, whatever it is. The most important thing is that it's consistent, and you try and do at least 3 to 4 hours a week. 30 minutes per day is very useful for helping someone lose weight, but to try to maintain that weight loss, you sometimes have to do 45 minutes to an hour every day. So finally, I'd like to say that I would rather see you as an acquaintance rather than a patient. So keep healthy, and I hope we meet under good circumstances rather than bad ones. Thank you.